everyone, welcome to Joy in Work. Okay, I'll be the first to admit it. The term joy in work might sound a little bit fluffy and might cause some nose wrinkles or cringes. Sad to say that I suspect that this is the reaction for most of us, whether in general or in nursing specifically. Hunkering down, riding out the storm, or getting through the day are much more familiar attitudes when it comes to dealing with an inevitably stressed work environment, where good people like you and me are trying to cope with systems that don't serve us well. What we in the healing professions have the privilege of doing every day touches the highest aspirations of compassionate civilization. We have chosen a profession that invites people who are worried and suffering to share their stories and allow us to help. If any work ought to give satisfaction to workers, this is it. Joy, not burnout, ought to rule the day. In our work in healthcare, joy is not just humane, it's instrumental. I'm sure that you've heard the idiom, you cannot pour from an empty cup. It stands to reason then that the gifts of hope, confidence, safety that healthcare should offer patients and their families can only come from a workforce that they themselves feel hopeful, confident, and safe. Joy in work is an essential resource for the enterprise of healing. So good news, joy is possible. We know it's possible, not only from intuition, but also from science. Since joy in work is a consequence of systems, quality improvement methods and tools have a role in its pursuit. That is to say, organizations and leaders that want to improve joy can do so using the same methods of aim setting, tests of change, and measurement that they use in more familiar terrain of clinical and operational process improvement. So listen up. Joy in work is not fluffy, I promise you. Improving joy in work is not only possible, but it's vital. Today, we'll help you all get started, and you might well find that the joy it helps uncover is in fact your own. Hi, my name is Holly Byrne, and I'm a duly registered RPN and RN with expertise in nursing professional practice with a special focus on creative problem solving and removing barriers to enable high quality outcomes and experiences for patients and enable best nursing practice. Last year, I took a course with the Institute for Healthcare Improvement, IHI, on finding and creating joy in work. This was our first assignment, an elevator pitch on why learning about joy in work is crucial to quality improvement in healthcare. Take a look.
Hi there. I'm learning about improving joy in work because I see it as an upstream approach to addressing the quadruple aim in healthcare. Improving joy in work can improve the patient experience, it can improve healthcare outcomes, it can reduce healthcare costs, but maybe most importantly, it can help improve the well-being of healthcare providers. That means people like me and you. Did you know that over 50% of nurses experience symptoms of burnout? Also, 3 out of 10 new nurses look for new jobs in their first year of work. That's really worrying. It makes me ask, what can we do? So I'm hoping to find ways that we can reconnect with our meaning and purpose so that we can model the way for registered practical nurses to reconnect with their meaning and purpose and help them find and sustain joy in their work. I'm really excited. Let's get started.
So hi and welcome. Thanks for joining me today for this talk on joy in work. I wish that I could be there with you in person, but hopefully this video will help to get you started and introduce the work that RPNEO is doing on finding and improving joy in work and helping RPNs to find and improve joy in their work. Today we're going to discuss the importance of joy in work, or the why. Then we're going to talk about the 4 steps to improve joy in work, and that's the how. Then we're going to talk specifically about the framework for improving joy in work that comes from the Institute for Healthcare Improvement, and that's the what. And then we're going to talk about some measurement and assessment tools that you're going to use in your projects, which Annette is going to talk about a little bit later. And then once I'm done talking in the video, Annette's going to talk to you about some examples for key change ideas, and she's going to go over how the Joy in Work Institute is going to work. But before we dive in, we just have to talk about something really important, and let's call it what it is: burnout. Burnout is the reduction of a fuel or substance to nothing through combustion, or physical or mental collapse by overwork or stress. Burnout is an epidemic among healthcare professionals, but it's not your fault. I'm going to say it one more time. It's not your fault. I felt strongly for some time now that burnout doesn't accurately describe the situation or place the right accountability for this problem, and struggled to come up with a better term. According to the Maslach Burnout Inventory, which is a validated tool to assess burnout, burnout is characterized by depersonalization, emotional exhaustion, cynicism, a low sense of personal accomplishment, and a low sense of professional efficacy. But the term burnout is victim shaming. The term burnout implies that nurses aren't strong enough, smart enough, adaptable enough, flexible enough, resilient enough, resourceful enough. It implies that nurses aren't enough to adapt to a system that is harming its most valuable asset, healthcare professionals. I think that what is actually happening to nurses is closer to moral distress or moral injury. Nurses experience moral distress or moral injury when we face a variety of barriers to providing the care that we know our patients and their families deserve. Humans are moral, idealistic creatures with a set of core values. We care about other human beings. That's why we came to this profession. When we become a part of or bear witness to things that are against what we believe, we experience a moral injury. Until we start calling it what it is, we're never going to be able to treat it. So, how do you treat moral injury? You change the system that's causing the injury. So this is a call to action. Talk about moral injury with your colleagues and with your leaders to start to change the conversation around burnout, and recognize that moral distress is a system problem. It's not because you're not strong enough. We have to start looking at our units, our teams, our organizations, the profession, and the system as a whole to identify these barriers, to address the fundamental conflict of moral distress, and stop blaming nurses for their supposed lack of resilience. So later on in this presentation, if I say burnout, I'm going to always try to also say moral distress. And I would challenge us to try to start to change the language that we use when we talk about what we've known for years as burnout. Okay, let's talk about the importance of joy in work, or the why of what we're doing here today. With increasing demands on time, resources, and energy, in addition to poorly designed systems of daily work, it's not surprising that healthcare professionals are experiencing moral distress at increasingly higher rates, and that staff turnover rates are also on the rise. Yet joy in work is more than just the absence of burnout or moral distress. or an issue of individual wellness. It is a system property, okay? It is generated or not by the system and occurs or not organization-wide. Joy in work, or lack thereof, not only impacts individual staff engagement and satisfaction, but also patient experience, quality of care, patient safety, and organizational performance. Burnout or moral distress affects all aspects of the pursuit for better health and better healthcare. It leads to lower levels of staff engagement, which correlate with lower patient experience, lower productivity, and an increased risk of adverse events. These all significantly affect the financial vitality of an organization and our health system overall. And the impact on patient care is even more worrying. Lower levels of staff engagement are linked with lower quality patient care, including safety. And burnout or moral distress limits our ability to be empathetic with people. Okay, so why use the term joy in work? Some may think that focusing on joy in healthcare, a physically, intellectually, and emotionally demanding profession, is a distant goal. But focusing on joy is important for three fundamental reasons. First, focusing on joy, as opposed to focusing only on burnout or moral distress or low levels of staff engagement, aligns with an approach to problem solving that has addressed many intractable problems in healthcare. It's tempting to analyze a problem only by paying attention to deficits or gaps. But to get to solutions, it's essential to identify, understand, and leverage all assets that can be brought to bear. And joy is one of healthcare's greatest assets. The compassion and dedication of healthcare professionals is an asset that, if nurtured and not impeded, can lead to joy as well as to effective and empathetic care. This assets-based approach to improvement enables people to look at issues from different perspectives, which often leads to designing much more innovative solutions. So that's one. The sociologist Aaron Antonovsky taught us to think of health as more than merely the absence of disease. We know this, right? This is Nursing 101. Health is about coherence, he said, a sense that life is comprehensible, manageable, and meaningful. So, following Antonovsky's lead, the second reason to focus on joy in work is because joy is about more than merely the absence of burnout or moral distress. Joy, like Antonovsky's conception of health, is about connections to the meaning and purpose. By focusing on joy through this lens, healthcare leaders can reduce burnout, moral distress, while simultaneously building resilience of healthcare professionals that rely on each other every day. Again, the goal is to design innovative solutions by looking at issues from a different perspective. The third reason for focusing on joy in work comes from management principles. Consider, for example, the principle that removing barriers that rob the professional of their right to pride of workmanship. Or the principle that removing barriers that rob the people in management and engineering of their right to pride of workmanship. Pride of workmanship and joy are highly related, almost interchangeable. The person that came up with these management principles is W. Edwards Deming. And Deming increasingly emphasized later in his life the importance of joy in work. In some of his final lectures, he routinely stated that management's overall aim should be to create a system in which everybody can take joy in their work. Ensuring joy is a crucial component of the psychology of change, one of the cornerstones of Deming's scientific approach to improvement. In addition to being a core part of his theory of improvement, joy in work to Deming was also a fundamental right. So it's up to leaders, he argued, to ensure that workers can enjoy that right. The case for improving joy in work. Perhaps the best case for improving joy in work is that it incorporates the most essential aspects of positive daily work life. A focus on joy is a step towards creating safe, humane places for people to find meaning and purpose in their work. This is from Don Berwick. He's Professor Emeritus of IHI. There's also a strong business case for improving joy in work. Recognizing that joy does not yet have a single validated measure, which we'll discuss more in the measurement section, the business case draws on outcomes of the work environment, including engagement, satisfaction, patient experience, retention, and moral distress. Engagement is an imprecise yet often used measure for joy. An engaged workforce is one that holds a positive attitude towards the organization and its values, and is foundational in creating a high-performing organization or team. When researchers studied human resources metrics like average time to fill open positions or the total hours of training provided, they found that employee engagement was a significant relevant factor. Moreover, studies have demonstrated the relationship between performance and employee engagement. It enables greater professional productivity and lower turnover rates. Joy in work, in turn, improves patient experience, outcomes, safety, and results in substantially lower costs. Many have documented the correlation between greater employee satisfaction and safer, more efficient patient care. There is ample evidence that management practices to produce a joyful, more engaged workforce are associated with fewer medical errors, better patient experience, less waste, higher employee productivity, and more discretionary effort on the part of staff and reduced turnover, leading to better financial performance overall. Studies have also shown a link between job dissatisfaction and plans for leaving a job. Makes sense, right? By considering employee turnover as a factor that's associated with joy in work, it's possible to make an explicit financial case as well. A survey study from 2008 involving respondents from all 10 provinces examined the magnitude and cost of nurse turnover in Canadian hospitals. I realize that 2008 was some time ago now, but I'm not sure that we have such comprehensive data that's more up to date. So we'll use this study as a reference point and take into consideration that it is more than 10 years old at this point. The average annual turnover rate was nearly 20%. And the average cost associated with nurse turnover was $25,000 per one full-time position, one FTE. So more than 10 years ago. So you can add whatever standard appreciation rate, like a 2% inflation to that, and do some math. It doesn't get better. Let's just put it that way. The high cost was largely attributed to lower productivity of new hires and the higher costs of hiring temporary replacements. Higher nurse turnover was associated with lower job satisfaction, higher probability of medical errors, and increased overtime hours. No surprises there, right? So let's talk about some steps that leaders can take to get started. We'll start with these 4 steps outlined by the IHI Framework for Improving Joy in Work. 4 steps for leaders. That's you. As you begin to engage with your colleagues, your organization's formal leaders, and other stakeholders in thinking about how to restore, foster, and nurture joy in work, you may find it challenging to see a way to move from your current state towards joy in work. So here are the 4 steps to help you find a path forward. Step 1, ask your colleagues what matters to you. Step 2, identify unique impediments or barriers to joy in work in your local context. Step 3 is commit to a system approach in making joy in work a shared responsibility at all levels. Step 4, use improvement science, or quality improvement, as we call it in healthcare, to test approaches to improving joy in your organization. We're going to hear more about quality improvement as part of the RPNAO Joy in Work Institute. We have a great expert lined up to come and talk to you about it. So these steps are deliberately depicted like a staircase to illustrate that each step serves as a foundation to the next one. So first, leaders engage colleagues to identify what matters to them. Next, leaders identify process issues or circumstances that are impediments to what matters. Think of this like pebbles in your shoe that get in the way of meeting professional, social, and psychological needs. That's step 2. Then, in partnership with multidisciplinary teams, come together and share responsibility for removing these impediments, focusing on the 9 core components for improving joy in work. Don't worry, you'll see the framework soon. That's step 3. Leaders and staff then use improvement science together to accelerate improvement and create more joyful and productive places to work. That's step 4. Keep in mind that the 4 steps don't ignore larger organizational issues or boulders, not pebbles, boulders that exist, such as the impact of electronic health records on a nurse's daily work or workload and staffing issues. Those are boulders. Rather, the steps empower local teams to identify and address impediments that you can change, while larger system-wide issues that affect joy in work are also being prioritized and addressed by your senior leaders. This process shifts the conversation from if only they would to what can we do today? It helps everyone see the organization as us, not them. So before you jump into your 4 steps, there's some work that needs to happen to get ready, essentially. So let's establish a foundation for success. Prepare for the what matters to you conversations. These are rich learning conversations, not intended to communicate information, but rather to generously listen and learn. Leaders and colleagues should recognize this as a different approach to the usual, I'll tell you what isn't working and you fix it. We'll provide you with a guide for conducting effective what matters to you conversations and resolving the issues that arise from these conversations as well. The guide helps you get started quickly and learn as you go. The next thing you need to do to get ready is to ensure leader capacity at all levels of the organization. This is kind of like getting buy-in. Leaders at the local level, so program, department, clinic, are tasked with guiding the work to improve joy in work in their respective areas. These leaders need the capacity. That means not only the time to do the work, but the quality improvement skills, which you're going to learn in the Institute. Don't worry, you'll hear more about them later. And skill to facilitate the what matters to you conversations. That's where the guide comes in. Finally, you need the skill to act on the issues that surface. Identifying impediments and then not doing anything about them only intensifies rather than diminishes cynicism. Organizations that made progress towards reaching their goals were ones that designated skilled and committed clinical leaders who facilitated improvement immediately. Finally, designate a senior leader champion. Optimally, Joy in Work is an organization-wide strategy led by senior leaders and involving colleagues and leaders at all levels. Clinical leaders need to have at least one senior leader as a champion. This is either your senior leader as part of your dyad or your executive sponsor in your organization. So that when an issue arises that's beyond the scope of their local leadership, the champion can take on the boulders that are too difficult for the local unit and begin to address them in the larger organization. Okay, let's start talking about the 4 steps. Step 1, ask your colleagues what matters to you. This step is about asking the right questions and about really listening to the answers that identify what contributes to or detracts from joy in work. Only by understanding what truly matters to nurses will senior management be able to identify and remove barriers to joy. Some organizations found it helpful to start with identifying a senior leader, champion, who commits to making joy in work a shared responsibility at all levels. Really, this is step 3, but it's part of the get ready work that we just talked about as well. Highlighting senior leader support enabled staff to feel more comfortable bringing up issues and being honest about what matters to them. Whether or not a champion is identified at the outset, leaders can support the process and show a genuine interest in the well-being of individuals and teams by regularly engaging colleagues in discussions to identify the unique and local organizational opportunities to improve joy in work. This is focusing on bright spots that offer energy for change. Some examples of questions that you can get started, but we're going to give you a full guide as part of your Joy in Work Institute. But examples to help you get started include: what makes a good day for you? What makes you proud to work here? And when we are at our best, what does that look like? So discovering what really matters relies heavily on trusting relationships and assume that leaders know how to listen. This isn't always the case. Strong leaders use effective listening and communication skills to involve others, build consensus, and influence decisions. Identifying what matters need not take a lot of time. However, what works in one setting might not work in another. It's up to you to find the method that works best for your colleagues and fits into your daily or weekly workflow. The idea here is not to create more work. It's to make your day better, improve joy in work. This then sets the context for asking what gets in the way of a good day or what makes for a bad day. Both questions are important to ask. Step 2, identify unique barriers to joy in work in your local context. Steps 1 and 2 usually happen at the same time. They can be the same conversation, or they may continue over time as well. Having conversations about what really matters to each person builds the trust needed to identify frustrations they experience during their workday. Everyone must feel like their ideas, opinions, and comments will be listened to before they can be open and honest. Just as answers to the question, what matters to you, will vary depending on the individual, the system-level barriers to joy in work will also vary depending on the organization, department, program, or clinic. You get it. Responses to this question, in combination with other real-time data collection and surveys, which we'll talk about more in the measurement section, enable leaders to build a comprehensive understanding of what contributes to joy in work in the organization, as well as what doesn't. In step 2, Identifying unique local barriers to joy in work is how leaders can begin to address the psychological needs of their people. By building on the what matters to you conversations, leaders work with colleagues to identify barriers that exist in daily work. This is the pebbles in your shoe. And then set priorities and address them together. This offers everyone a chance to give input on which impediments to address, build camaraderie by working together to remove the barriers, and practice equity in respecting all voices. Now on to step 3. Commit to a systems approach to making joy in work a shared responsibility at all levels of the organization. Making a workplace joyful is the job of leaders. Nevertheless, everyone from senior executive leaders to clinical leaders and administrative staff have an important role to play. From creating effective systems to building teams to bolstering one's own resilience and supporting a positive culture, each person contributes. It's critical for leaders at all levels to dedicate time, attention, skill development, and necessary resources to improving joy in work. Improving joy in work is directly linked to the skills of leaders at all levels. Organizations cannot just delegate the responsibility for joy in work to one department. It's everyone's job. In step 3, it's most important to note that although there's a shared responsibility, not everyone needs to do everything. The IHI framework for improving joy in work shows 9 core components that contribute to a happy, healthy, productive workforce. In addition, there are 3 rings on the outside that indicate who is responsible for which of the components. Senior leaders are responsible for all 9 components. Managers and clinical leaders are responsible for 5 components, and individuals are responsible for 3 components. The responsibilities outlined in the framework are meant to help leaders assess and plan for ongoing development of behaviors and systems at all levels to improve and sustain joy in work. So this means when you're thinking about your project proposals for the Joy in Work Institute, and you're choosing which core component of joy in work that you'd like to focus on, it must be one of the following 5. Real-time measurement, wellness and resilience, daily improvement, camaraderie and teamwork, or participative management. Don't worry, we'll go over all this later, and that will be able to answer your questions as well. Step 4, use improvement science, quality improvement, to test approaches to improving joy in work in your organization. There are many ways to take a systems approach to improving joy in work. The aim is to make the change process rewarding and effective, not to make more work, right? Improve joy in work. Using principles of quality improvement, organizations can determine if changes they test are leading to improvement, if they're effective in different programs, departments, clinics, and if they're sustainable. For your project proposals, you'll be using the model for improvement, we'll provide it, or another improvement method that's already standard in your organization. In all cases, you set the aim for your work, decide on measures that will tell you if you're making progress, and then select the component from the framework for improving joy in work as an area in which to test changes, one of those 5 that were just mentioned. Okay, here's the framework finally. The IHI framework for improving joy in work shows 9 core components that contribute to happy, healthy, productive workforce. In addition, the rings on the outside show who's responsible for which components. As we previously mentioned, senior leaders are responsible for all 9 components. Managers and clinical leaders are responsible for 5 components, and individuals are responsible for 3 components. The responsibilities outlined in the framework are meant to help leaders assess and plan for ongoing development of behaviors and systems that help to improve and sustain joy in work. Before you get going, certain barriers to joy need to be addressed before others, and it's critical to recognize some basic psychological preconditions for joy in work. With Maslow's hierarchy of needs in mind, we all know Maslow's hierarchy of needs, right? The IHI identified that 5 fundamental human needs must be met in order to improve joy in work. These 5 needs play a central role in the IHI framework for improving joy in work, and they are physical and psychological safety. We're reading from the list on the right now. Meaning and purpose, choice and autonomy, camaraderie and teamwork, and fairness and equity. That's like an underlying principle. It's not one of the 9 components. It's an underlying principle of the whole framework. So don't worry if you don't see it up there. While all of these 5 human needs will not be resolved before addressing local impediments to joy in work, actions and a commitment to addressing all 5 will ensure lasting results. Okay, finally, let's talk about the 9 core components of joy in work. First, you've got real-time measurement. That means contributing to regular feedback systems and radical candor in assessments. Next, you've got wellness and resilience, health and wellness self-care, cultivating resilience and stress management, role modeling values, appreciation for the whole person and family, work-life balance, and mental health support. Next is daily improvement. Employing the knowledge of improvement science to recognize opportunities, that's quality improvement, and regular proactive learning from defeats and successes. Next is camaraderie and teamwork. Commensality, which means sharing meals together, social cohesion, productive teams, shared understanding, and trusting relationships. Next is physical and psychological safety. Moving to the right side of the diagram now. Equitable environments, free from harm, a just culture that is safe and respectful, and support for the second victim. This is a blame-free type culture. Next, you've got meaning and purpose. This is daily work connected to each individual's why of what they do and line of sight to organization, mission, goals, and consistency of purpose. Next, you've got choice and autonomy. This is an environment that supports choice and flexibility in how you do your work. Sometimes that means flexibility in work hours. It can mean use of electronic health records. It depends. Next is recognition and rewards. Leaders understand daily work, recognizing what team members are doing and celebrating outcomes. Last, down at the bottom there, you have participative management, which falls on both the left and the right side of the framework. Participative management is the co-production of joy. It's leaders creating space to hear and listen and involve before acting. It's clear communication and consensus building as part of decision making. So now we get to talk about measurement. How can one measure joy? Currently, there is no single validated measure for joy in work. And until there is, leaders need to draw on other indicators that are known to contribute to or signal trouble for joy in work. Measuring joy in work calls for both system level and local level measures. 2 or 3 system level measures, such as engagement, satisfaction, turnover or retention, burnout or moral distress, employee well-being, workplace injuries or absenteeism, can be reviewed at least annually to identify areas for improvement and to track progress over time. Local level measures, or assessments that occur more frequently, that local leaders can use for improvement on a daily or weekly basis. Daily or weekly assessments of joy in work are initiated and tracked by staff themselves, along with the core leader of the unit, clinic, or department. The timing of these local assessments matters. Assessments can occur after an event, such as an adverse event, or after an interval, such as a day or a week, or at random. It's particularly helpful if you can stratify the data by unit, department, discipline, or other demographic factors, like age, for example, given our multi-generational nursing workforce. By drilling down into different units or groups of staff, organizations can identify areas in which to focus their improvement efforts first. More frequent and tailored data collection and transparent sharing of results with each work unit and its leaders allows for more real-time improvement and a better way to track the impact of changes over time. I think the key thing here is transparency and access to the results. For your projects, we'll provide some examples of existing measurement and assessment tools for improving joy in work that you can adopt or adapt. No single measurement system is universally applicable. And the most practical approach is to leverage existing measurement data in your organization, like satisfaction, engagement, moral distress or burnout, turnover, retention, or absenteeism, and measure them more frequently over time. Rather than starting from scratch, many organizations choose to incorporate a few questions from other assessments into existing measurement tools. You may choose to take this course of action. It's certainly an option for you. Regardless of what is measured, leaders need to track data regularly, make the results transparent and accessible, and address the issues that are identified as a priority. It's important for joy in work to be a key organizational metric on the same level as other organizational priorities and measures. This sends an important message to staff about the culture and values of the organization. Now I'll turn it over to Annette Weirs. She's going to discuss some examples of key change ideas, as well as the RPNAO Joy in Work Institute specifically. So thanks for listening, and I can't wait to work with you to help you find and improve joy in your work. Have a great day.